issue in my good old doc. Trust issue where my friends all talk.
Our last speaker in the field of metabolic psychiatry is Dr. Matt Bernstein, a clinical psychiatrist with 20 years experience, and he's the CEO of Accord, a pioneer in residential care that focuses on both mental and metabolic health. Please welcome Dr. Bernstein.
Great to be here. Thank you to Jess and all the volunteers for making this event happen. Thank you to all of you for being here. And as Nina said, I'm a clinical psychiatrist. I have really been for about 25 years, trained and worked in some highly respected institutions up in Boston. And I really started my career on an inpatient unit focusing on psychotic disorders. And since then, I've been working in outpatient settings, working with complex people full time. So I'm going to share some of my experience in the psychiatric system with you. It's really not like me to get up on a big stage, so I'm going to ask at certain times for you guys to help me out. So sometimes some booing, maybe sometimes some cheering. Over the years, I've prescribed psychiatric medications many thousands of times. It's okay to give a little boo there. I can take it. I've seen them do some good, including reducing and occasionally even reversing troubling symptoms. A little cheer, sometimes they do. I've even seen them pull people from the brink and save lives when the chips are really down. That does deserve a cheer. But here's the thing. They almost never lead to a complete recovery on their own. Boo! That's right. And they've got serious, serious problems. The big boos are coming. When I was on an inpatient unit, it was not uncommon to see people gain 25 pounds in less than a month. And that was not just because of the food we were feeding, the lack of exercise, but it also was due to the medications. I was part of that system of care that was causing severe metabolic dysfunction. Boo. When someone came to the inpatient unit and I diagnosed them with a psychotic disorder, what did I tell them? I said, well, you got plenty of options for treatment. What I didn't tell them, but I knew, is that most of those options were going to make them ravenously hungry, damage their metabolism, have a high risk of neurological side effects, make them sedated and unmotivated, probably impair their cognition. And by the way, you've got to take it for the rest of your life. Boo. At that point in my career, I did not know how to provide any good options. So then after discharge, some of those folks, in fact, most of those folks, wouldn't get back to their level of functioning. They would have awful side effects. And so what would they do? What was the rational choice? Well, I'm going to stop that medication. And you know what I would do? Well, I did what I was unfortunately trained to do. I would call those people non-compliant, you've got poor insight, essentially blaming people for not recovering. That's a big boo. That's not okay. It's a really broken system. However, due to the pioneering work of many of the people I'm honored to share this stage with and others, we do have better options. Huzzah! Here's something that no one learns in psychiatry training. The right food and exercise are powerful medicine, capable of reversing the most severe and chronic mental health conditions. I've seen it with my own eyes. That's a huzzah. With this metabolic approach, we can not only reduce symptoms, but allow individuals to get back their energy, their vitality, and most importantly, empower them to regain control over their bodies, their brains, and their lives. Huzzah! I never have to tell someone again that they don't have any good options. So now I've got a couple of yes-no questions for you. Is it okay to have USDA food guidelines that damage people's metabolisms and contribute to skyrocketing levels of mental illness? No. Is it okay to tell people who are having mental health struggles that they need to stay on medications that will ruin their metabolic health? No. Is it okay to blame people for not wanting to take medications that don't improve the quality of their lives and cause them to become metabolically unhealthy? No. So let me ask you, this beautiful community here, are we going to reform the way we treat the most vulnerable among us? Yes. Are we going to let food be our medicine? Yes. Are we going to demand a metabolic revolution? Yes. Thank you.